Hi guys, and welcome back to another episode of Milk and Mummies. Today I'm joined by the lovely paediatric dentist, Dr. Disha Khemani, and we are going to be talking about all things tiny teeth and how to build healthy habits before we get stuck in the unhealthy ones. Anyway, let's get into it. Hi.
Hello. Hi.
How you doing?
Good, thank you. How are you?
I'm good. A little bit
Good.
windswept, as I was saying before.
Gosh, awful
Because
weather.
the English weather is doing English weather things. But
Absolutely.
I'm good. I'm glad you're here today. I'm glad we're able to get this in the diary.
Yes, me too.
I guess let's just jump straight into it. I'm sure you get this a lot, but what drew you into dentistry? And then also, how did you find your way into pediatric dentistry?
Yeah, so I kind of always wanted to be a dentist since I was really little. I think I first off wanted to be a mermaid, and that obviously didn't really work out for me.
Is
So
a
I had
shame.
to find the next best thing, which
Fair
was
enough.
being a dentist. But no, I always kind of loved kids. I've always wanted to do something like science-based, helping others. And as a kid, I always used to love going to the dentist. I think I was very lucky to never have any issues with my teeth. I think that definitely helped. But it just meant that I had nice experiences every time that I went. And then, just kind of family around and wanting to do something to help the community. I'm from Gibraltar in the south of Spain, and it's actually mandatory to go to the dentist every 6 months there.
Which is incredible.
Yeah.
We definitely don't have that here, do we?
No, we don't have that. So it's all funded by the government. So
Yeah.
obviously you don't have to pay a single penny to take your child to the dentist, which is amazing. Obviously we have that in the NHS service here, but it's so hard to get appointments. But there it was kind of like they took you out of school, took you to the dentist. So you were kind of going every 6 months, which meant, your relationship with dentistry is just normal and established.
that's
Like
true.
you're like, oh, I have to go every 6 months, and that's just the thing that I do. You carry that out throughout the rest of your life, basically. So that was always really good. And then in terms of pediatrics, I genuinely just like hanging out with kids. I would much rather have a conversation with a child than with an adult. I think I say that all the time. But even during uni, it always felt of a more natural kind of pathway for me, because it was just something I found that I was naturally quite good at, and kind of having the emotional side with the dental and sciencey side kind of mixed together, which was really nice. And then it's just kind of fell into it. So I graduated in 2017, and then you kind of have to do general dentistry for a few years before you pick kind of where you want to go. And so I only did my master's in pediatric dentistry in 2020, and that was 3 years. And then I'm working at a dental practice which only sees kids, which is amazing. So
So it's still quite a long journey, right?
It is, it is. But in that time, you're still learning and kind of figuring out what you like and what you don't like. So I think with dentistry, it's nice to have those years, because it helps you to figure out, okay, what am I naturally good at? What do I not really enjoy? What am I better at? What can I excel at? And then being able to kind of build on that is really important.
So I know you've just given like a rough overview of your background into it, but how long have you been working with children, pediatric dentistry in itself, and what keeps you passionate about it? I know you said you enjoy the company of kids, and I get it. They're so much fun. Every day's an adventure. Imaginations are phenomenal.
Exactly. The stories you get from some of these kids, you're like, you're so smart. Amazing. So I think honestly, throughout my whole dental career, I've always kind of veered towards seeing kids. So it's kind of been like constantly, even when I was seeing adults, my diary was mostly filled with kids, because a lot of dentists either prefer seeing adults or don't have the capacity to see kids. So I was kind of the person that they would just send their kids off to, which was great, fantastic for me. But then in terms of only pediatrics, it's probably been the last 4 or 5 years. I think it's really special kind of having a really anxious kid who doesn't want to come into the room, who's really scared, crying. And then, you just work on desensitizing them to the environment and just getting used to my face, my room, things like that. And then over a few months or over a few years, they're then running into the room, giving you a hug, jumping on the chair, and you're like, oh wow, I had something to do with that. And that's so rewarding. It's like one of the best parts of the job, genuinely.
That's 110% accurate in the sense that I can corroborate that. Like my daughter, Zena absolutely adores you. Anything, and the thing is, you've now gone from being her dentist to anything that's gone wrong. If she stubbed her toe, Dr. Disha was, doctor, that's how Dr. Disha about it. Genuinely, you are her go-to, like, other person to go to for any injuries. And it is true watching her change from her first visit to the dentist.
Absolutely.
And now super comfortable, super confident.
Sat on the chair by herself, like unfazed, opening, like doesn't even flinch.
Yeah.
Like,
and
amazing.
She loves brushing her teeth and taking care of it all, and she knows what steps that she needs to take. And it's amazing watching. I think you met her at 18 months?
Tiny, yeah.
Something like that.
Yeah, she was
and where she is now, she knows exactly what to do and why she's doing it, and she has the most fun.
No, and that speaks volumes to you guys at home as well, because there's only so much that I can do, right? I see them for like half an hour, 45 minutes, and then it's all about what the parents are doing at home and like continuing that good relationship with oral health. Like that's so important.
Yeah. What's one myth or misconception that you find that you're having to debunk a lot of the time when it comes to kids or pediatric dentistry?
Yeah, so I think the main one genuinely is loads of parents are like, oh, they're just baby teeth, it's fine. Like they'll fall out, it's fine. And you're like, no, well, yes, but no.
Not quite how it works.
So basically, baby teeth are so important. They guide the adult teeth on where to go, when to come. Like they have such an important role.
Yeah.
And I think it's hard to kind of picture that baby teeth can cause problems as well, because they definitely can. Like having a cavity in a child's tooth will cause pain, will cause infection. Then you're putting them through having to get their teeth extracted when they're like 3, 4, 5 years old, and that's awful. Like nobody wants that for their child. And so I just really important that no, it's not just their baby teeth. They still have cavities. They still need to get them fixed.
Yeah.
I think another one would be, oh, my child's too young to come to the dentist. And you've just said Zena came when she was so little, and that's so important. Because it's not so much, oh, they need to have a full checkup. It's more, no, you need to establish that routine of, like I said, every 6 months going to the dentist and having that good relationship, establishing good habits from when they're super tiny and super little. So actually we recommend them coming by the age of 12 months, like a year, because that's when they're learning, they're picking up on things, and just getting them used to coming is good enough. Like that's really important. And then I would just say as well, like, you know, a lot of parents would say, oh, my child doesn't eat that much sugar, so she can't have any cavities, or they can't have any cavities. And whilst that's true, it's so sad because nowadays there is hidden sugars in everything.
This is true,
like everything.
Yeah,
even as an adult, shocking.
Trying
it's really
to
shocking.
cut sugar out. It's true. It's everywhere.
It's impossible. Genuinely, I had a parent come to me a couple of weeks ago, and she was just like, honestly, she was so fed up. She was like, Disha, I don't know what to do. I went to the supermarket to get chicken nuggets, and in the coating of the chicken, there was like, I don't know how many grams of sugar. And she was like, what do I do? And I was like, yeah, I get it. It's really hard. Yeah. So again, it's just coming to get the good advice of, okay, how can I help the situation that we're in when we're constantly exposed to sugars, and how do I avoid it? What's the best time to avoid it? You know, all of that is advice that a dentist can give you.
Yeah. That's really good. I mean, just expanding on what you've just said a little bit. I guess for context, the reason why Zena went to the dentist so young was because breast milk was affecting her teeth, and that was something that I did not know. Yeah. And Zena was breastfed, as I've just said, and any feeding throughout the night, because she's not producing as much saliva while she's asleep. It's allowing whatever residue of breast milk that's left to sit on her teeth, and then that started to affect it. Yeah. And that's something, as I said, was brand new information to me. So even things like that, it's important for you to understand how to navigate those spaces, or what to do, or what to pay attention to, because yes, the teeth are coming in and they're forming. But even natural occurring sugars, or sugars are being produced from your milk, it can still have an impact.
Exactly. Yeah. And it's also kind of like, ultimately, you know, you're going to make the best decision for your child. We are here to give you the advice, to say, okay, it's great that you're breastfeeding, and you know, as long as you need to go, you go, whatever you feel is right. But it's my role as the dentist to just warn you that on-demand feeding throughout the night increases their risk of getting a cavity. It's not a hard and fast rule that just because you're breastfeeding at night, you're definitely going to get decay. It's just you have a higher risk, because then it's more like, if you are going to do it, try and brush your teeth after, or if you're doing it straight after kind of a meal, like that's better almost. Like it's kind of like finding ways to do it that are better for your teeth, right? And it's really tricky because after you feed, they fall asleep. So you're not exactly going to wake them up and be like, oh, I need to brush your teeth. But also it's one of those things where once, they're getting more and more teeth, I think naturally parents would kind of avoid breastfeeding because it's uncomfortable for you as well, right? So I think it's one of those things where just the timing for each family, it needs to be established. That's all it is.
It's so true. Sugar it feels like it is everywhere. So if you were to give advice to parents dealing with their kids' teeth, whether it's brand new or not, what's the best way to go around dealing with sugar in their diet?
Yeah, good question. It is really, really tricky. Exactly what you said. It's everywhere. It's unavoidable. I think it would be the most unrealistic thing for me to be like, don't give your child any sugar.
Yeah.
That's not happening. We need to be realistic about this. I think one of the most important things is introducing it as late as you can.
Okay.
So like even like avoiding things like honey, like some people will put honey in like yogurt or in milk, like trying to avoid introducing that sugar for as long as you physically can. Because honestly, once they start going to nursery, once they start socializing, it's so hard because, they see their peers, they see other kids having it, and you kind of just like, you feel like that awful parent that's like, no, you can't have that. Like that's not nice, right? So it's all about balance. And the main thing is, so your teeth can essentially handle, let's say 5 sugar attacks a day. So that's breakfast, lunch, dinner, and then 2 snacks. So if your 2 snacks are sugar-free, sugar-free, I wouldn't even say low sugar, just literally completely sugar-free, then your chances of getting a cavity are significantly reduced. And so that means that you've got 3 meals of the day, so breakfast, lunch, and dinner, where you can safely introduce some sugars. So any sweets, any chocolates, any processed fruits, so any dried fruits, any flavored yogurts.
Okay.
All of these things that have those hidden sugars like we mentioned. If you give them straight after the meal, so straight after lunch, straight after dinner as dessert, it's much better for your teeth. Because during that meal, your teeth have already been exposed to sugar. So let's say you're having like a sandwich or you're having pasta, like those carbs are turning into sugars when they're being digested. And so then if you're introducing something really sugary, it's still just one attack.
Got you.
Obviously balance with the rest of your body. You're not going to give your child a bowl full of 10 Haribos, but technically you
as
could.
Much as they would, as much as they want it.
Exactly.
They will hunt you down for it.
All balance. And then for the snacks, I think it's always tricky for parents to come up with like creative ways of like snacking. But the best thing is to have salty, savory things. So fresh fruit and fresh vegetables always. A dentist is never going to be someone that tells you don't eat fruit. I think a lot of parents panic about giving their children fruit. And when it comes to that, what you need to focus on is it's more about the acidity rather than the sugars when it comes to fruit. So really citrusy stuff, oranges or like the berries, those tend to be higher in acid. And what we worry about is baby teeth are not as resistant as our teeth are to resisting these acids. So they wear down, so they become a little bit thinner. And so it's hard because you want to try and encourage giving them fruit.
Of course,
like that's such a good thing.
Healthy,
Exactly. So it's actually a good thing to finish off, let's say they're having a bowl of berries, finish it off with a little block of cheese. A little bit of yogurt, like something to just remove the acid. And then for the snacking, crackers, cheese, nuts, olives, hummus, salty pretzels, salty popcorn. You can tell I say this all day long. But those are the best kind of snacks to encourage when your child's hungry, basically.
I wanted to touch on fluoride. I think once I started to pay attention to Zena's teeth and what we're doing and how we're using it, I definitely started to see more things about fluoride here and there. Thank you, social media algorithm. But I wanted to understand why it's such a hot topic, or why it can split the room in terms of what to do and what not to do. If there are any thoughts that you can share on that would be super helpful.
So definitely fluoride is something that sparks some debate. I think there's been a lot of kind of research, a lot of conflicting evidence. And so, in some ways it's really, really helpful. In other ways, there are kind of long-term side effects with ingesting large amounts of fluoride, which to be fair is quite unrealistic, like in terms of what your getting fluoride from, which is toothpaste, is the main source of fluoride, as well as any like mouthwashes and stuff that you're using. But in terms of the fluoride in toothpaste, the concentration of that is evidently good for your teeth and good for your body. And so it's just important that you're using the right amount at the right age and the right quantity of toothpaste. So what that means and what the evidence shows is from 0 to 2 years old, the recommended amount is 1,000 parts per million of fluoride, and you're using a smear. So it's literally like a little smidge of toothpaste. It's like not like a full on, like in the adverts, a Colgate advert, you're like, whoa,
the full little swoopy thing that they put on.
No, that's way too much. So you're literally just putting a smear. And I think at that age, what parents find really tricky is that kids just want to eat the toothpaste because it tastes so good.
This is true.
And it's fine. It's normal. And so what I tend to recommend is if they are just, you feel like they're eating a lot of the toothpaste or they're playing around a lot with the toothbrush, is use a non-fluoride toothpaste for that. Not a problem. But then when you're going in and doing the proper toothbrushing, you can use your smear of fluoride toothpaste. And then from the ages of 3 upwards, you're then bumping up the fluoride content, because by that age, you know, they're learning how to spit. So they're spitting out any excess fluoride toothpaste that's in their mouth. And also you're also increasing the quantity of toothpaste. So you kind of go from a smear to a pea size. And again, that's the right amount for your teeth. There's no evidence of any long-term, you know, side effects as long as you're using the right amount in the right way. Like any substance, right? If you overuse anything, there's going to be harmful effects.
This is true. This is fair.
Yeah.
What are some early signs that parents should look out for when it comes to their children's oral health?
Yeah, really good question. I think it's really important to look out for any changes in color, like white spots, brown spots, stainings. You know, I always feel like I get parents coming in and being like, oh, I think I'm being too paranoid. Like, no, there's no such thing. Like, please be paranoid. Please come in. It's better. Like, I'd rather be like, oh, don't worry, it's nothing. Than you just keep an eye on it for ages and then it becomes something. Like, that's so much worse, right? So definitely keep an eye out for any stainings, any patches or discolorations that you notice. Milestones is quite a big thing as well. So making sure that the pattern of teeth coming through is the right pattern. Rather than the ages. I think back in the day we used to be like, oh, when they're 6 months, this tooth should be there. And when they're 1 year old, this tooth should be there. So we're kind of not really focusing on that anymore because there's just so much variation. It's more the order of the teeth coming through. So keep an eye on that. So if you notice, oh, like, I don't know, for example, her back teeth have come through and her front teeth are not in yet. That's not so normal. Like let me go see the dentist. So that's important. And then really, really important, like don't ignore your child when they say something's not right in their mouth. I think that's such a massive thing because I think we're so easy to be like, oh, you're fine, like you're good. But kids are so in tune with their bodies, it's mental. Like the number of times I've had a child come in being like, oh, like this tooth is hurting. And you have a look and you're like, oh, there's nothing, I can't see anything. And then you take an x-ray and you're like, oh,
there's something there.
Exactly. So like I would say that's like a big advice for parents. Like when your child is complaining about something, like don't ignore it. It's probably something's going on.
What advice would you give to parents about, I guess, caring for their babies' mouths or teeth even before the tooth has come in, basically, is what I'm trying to get to.
Yeah, so I think taking care of your child's teeth, like I mentioned before, it's all about establishing routine. Like making sure that as soon as that tooth comes through, you're brushing it.
Even like the first tooth?
First tooth, get the toothbrush in. Even if you're not using a toothbrush, you can use like a little finger glove. You can use like a little gauze, like just wipe any excess milk that's around the baby's mouth. Some parents also use that when there's no teeth, just to kind of just clean it around a little bit. Like that's also a great way of establishing a routine as well. And I think the most important thing as well is like just focusing on if you're, as a parent, if you are scared of the dentist, making sure that you are not passing that on to your child, that is like a massive thing, because most of the time anxiety is like inherited from the parent. And so some parents are really good. They'll be like, they'll tell me beforehand, like, oh, I'm really nervous about the dentist. So I'm sending my child with this person. And you're like, great, thank you for telling me that. Now I know how to manage it. Or even if you've got a really anxious parent, if they tell you, don't discuss a treatment in front of the child because I don't want to panic in front of them. Kind of thing. And you're like, okay, that's really good. So kind of being parents to be aware of themselves and how much they can cope with, I think is really important as well. And just making sure that you're not passing that on to the children.
It's true. Like they really see everything.
They do. They're so smart.
Like it's hilarious. Like watching Zena do some of the things. I'm like, I know I haven't sat down and showed you this, but she's just watching it, and then she does it on her toys, from the dinosaurs all the way to teddy bears to dolls. Like it's insane. Again, all part of the hilarious tapestry that is her, but it is insane how much she is picking up. And we know this
from you guys,
right? And we know that they're sponges, and we know. But to actually see it in real time and watching that play out is
wild.
Very scary and very hilarious at the same time. My goodness. I think you've talked a lot about the best parts of your job and what makes it so fun. And I'm not even a dentist, but I fully agree with you. But what are the most challenging parts of your job?
Yeah, there definitely are challenges. I think working with kids, it can be very emotionally draining sometimes.
Yeah. Okay.
I think I care a lot about the kids that I see. So I would often, like, if they're getting really upset, like it does affect me, and I always have to kind of take a step back and be like, okay, like I need to put my professional hat on and need to get this done. Like, you know, you saw yourself, like you were crying, I was crying, like it was just like
just a mess, but it felt good that we're all in it together.
You're all in it together, and I feel like exactly. It like depends on your relationship with the parent as well, right? You're kind of like, okay, like I feel like you're trusting me with your child, and I want to do the best that I can for your child. So, you know, there is definitely that emotional aspect where you're kind of like, okay, like I need to focus. I need to make sure that I'm not getting too invested in this child, or like almost like sometimes it's really sad when you're like putting everything into it and it's just not working, and you're like, I don't know what else I can do to like make this successful or make this patient feel calm or anything like that. Like there's only so much that you can do. So sometimes you go home and you're a bit like, okay, that wasn't a great day, but fine. Next day it'll be fine. So I think that's probably the hardest thing. The backache. There's a lot of weird positions that we need to go in to make things work. So that's definitely something. But genuinely overall, the challenges are worth it. Like the kind of pleasure and like the gratitude that I feel to be in this position where I'm helping children and like giving them good advice and like gaining their trust and able to kind of establish this good relationship between them and oral health. It's like, you know, it's such a nice part of the job. It's the best part of the job.
Yeah, and I think you definitely make them feel confident in the chair, genuinely, to watch Zena just kind of strut up there and sit up. Do you need mommy? No, I'm okay.
Yeah, she's like,
she's
good.
Ready to show you everything.
You guys were like, oh my gosh, she's sitting by herself.
Yeah.
She's an adult.
Yeah, that was, as per usual, it impacts the parent more than it does the kid.
Absolutely.
Having a great time.
I know.
You've mentioned earlier on, I guess, the differences in oral healthcare or dentistry in Gibraltar. How do you, with what you've seen here in the UK, what are you seeing shifting for the better or more positive?
For the better, interesting. I think in general, people are a bit more aware of teeth.
Yeah.
I think that definitely compared to like 10, 15 years ago, I think for sure parents and even adults, you know, we're so much more conscious of how our teeth look, how they feel. And whilst that's an amazing thing, there are obviously not so great things about people getting unnecessary work done to their teeth. But I do feel like people are more aware of teeth, and that means that they will get advice accordingly and they will seek care when they need to seek care. Obviously post-COVID,
of course,
it's been a little bit tricky. Like access to healthcare is definitely, access to dental care and healthcare has been something that's really put a damper on everything, I think. But that's finally getting better. I think like definitely easier to get appointments now. Everyone, if not most, you know, specialties are all back to seeing patients face to face. So I think that's made a massive difference post-COVID. But yeah, I would say.
Do you have an opinion on using manual toothbrushes or electric ones?
Yeah, so in terms of what the evidence shows, there is evidence that electric toothbrushes are clinically better and provide better results. But you have to use it properly. So I feel like a lot of people, I wouldn't even say kids, a lot of adults as well, feel like the electric toothbrush is just going to do all the hard work for you. Doesn't really work like that. Like you still need to move it around properly and take your time with it. And so I normally tell my kids, like, if you whatever you feel comfortable with. If you feel comfortable with a manual toothbrush, go for that. I'll teach you how to use it. If you are excited and want to use an electric toothbrush, great, I'll teach you how to use that. So genuinely, whatever feels more comfortable in your hands. I feel like some kids get a bit scared with the buzziness of the toothbrush as well. But then also they'll see their parents using an electric toothbrush and then they're like, oh, I want one of
That's it. And that was literally Zena's experience. She's seen us with one, so we got her one. And it's kind of more, I think, at least for her and her stage, the brush vibrates.
Yes,
so
exactly.
For her to get used to that idea.
Yes,
that's what
which
it's
is
going to
great.
feel like.
That's great.
But she absolutely loved it. The second she understood that we had one, it's like, well, where's mine?
What about me?
Yeah, we go. Exactly.
Which is great. Like, and to be fair, like the vibrating bit, it doesn't actually do anything in terms of cleaning effectiveness. But it, like you said, it introduces them to that sensation, which is such a weird sensation to get used to.
Yeah.
In terms of when you're a little bit older, so, you know, especially when you're looking at getting braces, that side of things, like your oral hygiene needs to be like really, really, really good, because once we're sticking things on to your teeth, you need to make sure that you can keep it clean, because otherwise we're in trouble. But yeah, so electric toothbrushes when they're a little bit older, like I would say like 6, 7, 8, 9 plus, it's really important that it's a round head and that the whole head rotates, so it's not just buzzing anymore. And Oral-B are great toothbrushes. They have like a stages toothbrush, which is age specific.
Oh, that's cool.
And that's dependent on like the size of the head and the bristles, which is again really important. So it's comfortable for them to use. Otherwise, they've got that big bulky one, which is
no, that's really nice to hear, because we are definitely an Oral-B household.
Yes.
So. Hey. Little win there. Ridiculous. If there's one piece of advice that you would give parents when it comes to their babies, their kids' oral hygiene and health, what would you say?
I would say be proactive, and, you know, keep an eye on your children, keep an eye out for any signs and symptoms that they may be experiencing. Take them to the dentist regularly. Make sure they've established the good routines of brushing twice a day, using a good toothpaste, diet controls, like keeping the sugary stuff to meal times only, and then ultimately just having a good overall relationship with their oral health, so that it sets them up for success as an adult.
Okay, that's awesome.
Yeah.
Okay, guys, thank you for watching. Sorry, English. But I mean, you guys know my English and hits the mic. My English has its moments. But no, thank you so much for watching. If you found anything here useful, relevant, please share it as far and as wide as you can. If you don't already follow, like and subscribe, please do all of those things. And if anything here that Dr. Disha had to say resonates with you, you can find her at
Happy Kids Dental in Marylebone.